Hello, my name is Brian Brewer, and today what we're going to be talking about is post-op instructions after implant surgery under local sedation. First and foremost, after the placement of the implant, do not disturb that wound. Basically, this means avoid rinsing your mouth or spitting anytime the rest of the day. And beginning the following day, the patient may rinse with warm salt water, which basically is about a half teaspoon of salt and 1 cup of warm water, every 2 to 3 hours for the first couple of days, and then after meals and at bedtime for the next 2 weeks. When prescribing Peridex rinse, make sure you tell the patient to follow the directions on the bottle. They're very self-explanatory, and the patient may begin brushing their teeth the same day, but make sure they stay away from the surgical site for at least a few days. If the doctor puts a temporary tooth on the implant the day of the surgery, it's very important that you tell the patient not to bite on the tooth until the doctor allows. Failure to comply with post-op instructions is the leading cause for failure. As far as dentures and other appliances go, we advise patients not to wear their dentures or their partials until we give them permission to do so. It is best not to wear your denture during the initial healing period. Once the swelling has subsided, you can place a soft reline to improve the comfort and fit of the denture. In some cases, swelling may occur and usually reaches its peak in about 48 to 72 hours, or around 2 to 3 days. Patients may apply an ice bag to the side of the face for 15 minutes and then 15 minutes off as often as possible for the first 2 days. Then change to a heating pad or a hot water bottle, 15 minutes on, then 15 minutes off until the swelling has receded. If a patient has mild discomfort following the surgery, we may want to prescribe the medication as directed with food, allowing 45 minutes for the medication to work. Therefore, take the medication before the pain becomes too severe. Take Tylenol or ibuprofen for minor discomfort. Now, occasionally, the cover screw or healing abutment may even loosen or even fall out. Inform them that this should not affect the stability of their implant. It is important, however, to let the patient know to call their doctor as soon as possible so they can replace it. Make sure that they bring the loosened component in with them to their appointment. Sutures are placed in the area of surgery to minimize post-operative bleeding and to help healing. People should be aware that sometimes they become dislodged. Explain to the patient that this is no cause for alarm. Just remove the suture from your mouth and discard it. The sutures will dissolve on their own, so there is no need for removal. Now, depending on the case, let the patient know that the doctor may use stitches that dissolve and fall out, depending on the type used. This may occur within the first week for yellow or clear stitches, or explain to the patient that bruising may occur, but it is not uncommon and should disappear soon. Explain that it is very important to keep lips moist with a cream or Vaseline to prevent them from cracking. Now, for those patients that do smoke, it's very important for us to let them know that smoking should be reduced or prohibited entirely until the implant has healed. Smoking has been linked to a very high increase in implant failures. So if they can reduce their smoking at least by half or even 100%, that would drastically increase the success of the implant. Next, remind patients that if any unusual symptoms occur, not to hesitate to call the office. If doctor has to be paged, please make sure you page the doctor and all the questions or concerns that you have are answered. Now, after surgery, if an antibiotic is prescribed and the patient is currently taking birth control, it is important to let the patient know to use an alternate method of birth control for the remainder of the cycle. This is because antibiotics reduce the effectiveness of the birth control. If a patient calls or comes to your office and is concerned with numbness of the lip, the chin, or even the tongue after the surgery has been done, let them know that this is no cause for alarm. These symptoms are very temporary in nature. If they do not go away, to come back and we will reassess the situation. If a patient calls and has a slight elevation in temperature immediately following the surgery, this is not uncommon. However, if the temperature persists, notify the office, and by taking Advil or ibuprofen should reduce the fever. Now, occasionally, patients may feel hard projections in the mouth with their tongue. These are not roots, they are the bony walls which supported the tooth. These projections usually smooth out spontaneously. If not, they can be removed by the surgeon. Patients should understand that sore throats and pain when swallowing are also not uncommon. These muscles get swollen after surgery. The normal act of swallowing can become very painful, but this will subside. After the surgery, remind the patient that the mouth had to be opened for extended periods of time and that it may be difficult opening and closing the mouth for a few days. They may get stiffness in the jaw muscles, but this is very normal post-operatively and will resolve over time. The swelling that is normally expected is usually proportional to the surgery involved. Swelling around the mouth, cheeks, eyes, and side of the face is not uncommon at all. This is the body's normal reaction to surgery and eventually will repair itself. Swelling may not become apparent until the day following the surgery and will not reach its maximum until 2 to 3 days after the surgery has been completed. However, swelling will minimize by the use of ice packs for the first 48 hours. Your office can provide the ice pack, or you can recommend that the patient use frozen bags of peas or something like that in the freezer. The ice pack or the peas should be applied to the sides of the face where the surgery was performed. The ice pack should be left continuously while you are awake on an ice bandage is usually helpful to keep the ice packs from moving. After 48 hours, the application of moist heat to the side of the face is beneficial in reducing the size of the swelling. For pain, we recommend taking the pain medication prescribed by the oral surgeon as directed. Begin taking the medication as the local anesthetic is wearing off. This usually occurs 3 to 8 hours after the surgery. Prescribed pain medication may make you groggy and will slow you down your reflexes. Do not drive an automobile or work any machinery while on this medication, and always avoid any alcoholic beverages. For breakthrough pain that persists after taking prescription pain medication, you can alternate with ibuprofen. Do not exceed more than 600 milligrams of ibuprofen every 6 hours, and do not take acetaminophen or any kind of blood thinner like aspirin. Nausea and pain medication may occur, but can be reduced by eating foods 30 minutes before taking your pain medication. If you do not become nauseated, you can also take 1/2 of your prescribed dose more frequently. If you continue to experience nausea or vomiting, please contact the office and we'll prescribe you a different type of medication. Pain or discomfort following the surgery should subside more and more as the days go on. If pain persists, it may require attention and you should contact the office directly. Antibiotics will be given to help prevent infection. If you have been placed on antibiotics, take the tablet or liquid as directed It is important to completely finish all the medications as directed. However, discontinue the antibiotic in the case of a rash or a reaction that you may have by taking it, and call our office immediately. Patients may find that eating yogurt with live or active cultures may decrease your chances of upset stomach or a yeast infection while taking the antibiotics. Like previously mentioned, if a patient is taking birth control pills, please inform them that antibiotics lower the effectiveness of those pills and to use alternate forms of protection. It is also important to remind the patient not to use straws when drinking from a glass. The sucking motion can dislodge the blood clot and increase your risk for dry socket. I also remind all the patients after surgery to avoid hot foods until the bleeding stops. Cold foods often can soothe any uncomfortable areas. I recommend milkshakes, yogurts, puddings, jellos, and applesauce usually works very well. You may tell the patient that they can advance to normal foods as they feel able, but avoid crunchy foods like popcorn and potato chips until the gum tissue has healed. Remind the patient that their food intake will be limited for the first few days. You should remind them to compensate for this by increasing their fluid intake. You may eat anything soft by chewing away from the surgical sites. High calorie, high protein intake is very important. Try not to miss any meals. You may feel better and have more strength, less discomfort, and heal faster if you continue to eat. After the surgery, it is important to maintain good oral hygiene. It is essential in healing. Brush your teeth gently, but do not use an electric or mechanical toothbrush such as a Sonicare or a water pick just yet. The sonic vibration can actually loosen the implant from the bone during the healing stage. Once the implant has completely healed, you may go back to using your electric toothbrush and water pick. And finally, remind the patient to use the Paradex or the chlorhexidine rinse 3 times a day. You may also rinse your mouth with a mixture of half peroxide and half water 3 times a day in order to maintain cleanliness. Thank you.